Thank you. I was waiting for the recording. Is it on?
We are live.
Brilliant. Okay. So I will start with introducing myself. I'm Rebecca Wilkinson. I'm one of the business analysts that work with NHIS. I work very closely with the training team. So I help to support in providing the content that we deliver during all of our training sessions. So anything that you guys feel is a training need in GP land, always let us know, and we can always adapt our training sessions to try and meet the needs of the practices. So what I'll start with is just our general offering. So something I kind of hope you already know about is obviously our new starter training. So anyone who's a new starter to the practice, both clinical and non-clinical, we provide free of charge new starter training to all staff. We also provide new starter training to sort of new roles as well. So even if you've worked in practice for a while, if you do change into a new role, so sort of maybe a HCA moves into a nurse role, a receptionist moves into a secretary role. Again, we can provide that training for them to help them with the sort of more advanced things within the clinical systems. Also, if you've been off long term, so long term sick, mat leave, anything like that, and you want a little bit of a refresher, again, we can provide that free of charge for you. I am just going to share my screen with you. So I do have a very little PowerPoint. It won't take too long, but just to give you an idea of the types of things that we do as well as new starter training. So again, I'm hoping that most of you will have heard of optimizing IT, but just to give you a little rundown of what it is, we basically have sort of a one-to-one session with the practice, looking within the actual unit, so System 1 or EMIS, and we have sort of a checklist that we run through, and the aim of it is to improve processes, to look at how you're working, how you're using System 1 and EMIS, and to try and support you with that. So a lot of the sessions tend to be us and the practice manager. Some practices find it very beneficial to have a few representatives, so a practice manager, maybe a higher level admin, and a clinical member of staff as well. So obviously, when we're talking about those processes, rather than having to jump off and find someone to ask questions, we've got all of that knowledge there in one room. So if I just go on to the next slide, this is a rundown of basically what we're covering in the next Optimizing IT annual review. So this is actually phase 5 for us. So the majority of your practices will have had at least sort of 1 to 3. 4 was last year's, and then we'll be moving on to looking at phase 5 in the next couple of weeks. So we've got a couple of pilot practices that we're going to do this with to start with. And then the dates will come out on our booking portal to allow you to book on for this phase very, very shortly. So the sort of things that we'll be looking at this time around, so we'll be rechecking things like safeguarding. So we look at how it's set up within the unit, how it's being used, if it's being used correctly, and give any pointers and things of how the processes should work. With the GP appointment data, we're going to be looking a bit more closely at this time. I know that the ICB are trying to improve the data quality of what we've got going on in the area. So something that we're going to be looking at in depth is looking at the dashboard with you, seeing where we can pinpoint any issues that we can try and resolve as quickly as possible. Obviously, there's a lot on here. I'm not going to go through everything. So we'll be having a quick look at SMS, residential institute codes to keep track of your care home patients. Another double check on things like the sharing rules to make sure we're not getting any unnecessary pop-ups when you're having sharing issues. And then some sort of workflow processes, so your pathology, tasks, links, anything like that. So you can see there's a really vast range of different things that we would work through within this session. So it can be really beneficial to have a few heads together from the practice to look at these processes and how we can improve them. Now, if there is any training that's identified off the back of these, we do offer sessions sort of further to this. So the annual review is more of a quick checklist, see how it's going, and then we might say, right, okay, so your HA links are looking a little bit busy. Perhaps we can support with that. Let's book a separate session with the appropriate people off the back of it. And so far, it's been really, really beneficial for a lot of practices. Obviously, a lot of practices are up to speed, but any that are sort of missing the new changes within the systems, we can update them and help them to improve their processes. So again, off the back of that, what we've done is identified the more common training needs. So rather than us going to every single practice and having the same session multiple times, what we've done is we've created some refresher training sessions. Now, these are slightly shorter than our normal sort of new starter sessions. So these are only an hour and a half each. So we have identified some clinical areas where we can support. So again, we've got workflow, consultations, patient record management, and also prescribing. So the general aim of these are quick hints and tips, ways that we can improve ways of working, making things quicker and more easy for clinical staff. We've also got admin, so appointment management, patient record management, prescription management, and workflow again. So you can see it's the similar sort of areas, but obviously looking at it from a different perspective. So they're quite nicely tailored to clinical and non-clinical staff. And then again, off the back of that, obviously we've had the discussions about online consultation tools and how they're working, sort of giving a little bit of advice on implementation and supporting practices with using them, but also trying to increase the uptake on the NHS app. So if I go onto this slide here, this is the course content. So again, it's an hour and a half session. So far has been really, really well received and is basically just looking at how the app works, how the app can benefit the practice and the patients. So both cost savings and time savings. And a lot of the admin staff that have attended these have really, it's sort of opened their eyes to the different things that there are available on the app that they didn't realise were there. So within this session, we focus a little bit within the clinical system on actually giving the access. I know that there are a lot of terminology differences between the app and the clinical systems, so we just try and clear those up a little bit. Managing the sensitive information within the record, providing proxy access if it's appropriate, and then actually having a bit of a navigate around the app itself. So finding out where the patients will go to find certain things, to request certain things, and also giving them the opportunity to be able to manage a lot of things themselves. So being able to reset their own passwords, have the notifications turned on and things like that. So your sort of benefits are going to be when you're sending out your text message reminders and things like that, they can come through the NHS app if you're using things like MJOG. And in the future, the communications annex through System 1 will also integrate with the NHS app. So that is eventually going to be quite a massive cost saving by using those functionalities. And hopefully the patients will start to get used to sort of using the app for absolutely everything, receiving their messages, receiving their results, and doing all their requesting of medications and things like that. So we're hoping to obviously get a wide reach on this. So far, we've had really good bookings. But yeah, if you'd like to sort of spread the word at the practice that these are available, that would be fantastic. And then the final thing is our primary care development centre sessions. So a lot of these are more admin based, but we do have a couple of more clinical sessions. So our safeguarding session, we do have an admin and a clinical version of this, and that just makes it a little bit more relevant to your role. So these are more high level sessions. These are a bit longer, so tend to be around 2 to 3 hours worth of training. So you can imagine how in depth these are. So the safeguarding will go through that full process from access rights to using templates and all that kind of thing. You've got communications annex, so that will literally be the setup all the way through to using it. So allowing presets, allowing patients to respond, using the booking links to send to patients to allow them to book specific appointments, and also the use of questionnaires and things like that as well. So if you're wanting to send out a pre-appointment questionnaire, you can code all of that back into the system quite easily. Your accelerated patient record access, which I would hope the majority of staff have already been on. So just with regards to the patients having access to their records. Reporting is probably quite a good one for a lot of staff. Again, it's very sort of in-depth of how to create reports, run reports, find reports. So if you do any kind of reporting within your job role, that would be a good one as well. So all of the links to these sessions are actually on this PowerPoint. So if it's okay, I can either drop this PowerPoint into the chat for use, or I can send through to someone for it to go out with the papers if that's useful. We have sent out a few comms about these sessions, but I know communication isn't always the easiest thing within primary care. So if we can just spread the word any way possible, and if you have any suggestions how we can advertise this to benefit your staff, again, suggestions are welcome. And that's pretty much it from me. So I will stop sharing my screen. And if anyone's got any questions, please feel free.
Great stuff. Thank you, Rebecca. We can certainly push your slides with our recording of today's session into our news, into our weekly update, or fortnightly update, sorry. I've got a couple of questions. When will the funding end? Because obviously you are currently funded by the ICB. So I'd imagine you're talking about stage 5 at the moment instead of stage 1. So how many stages are there left to come? And also when will the funding end, do you think?
So I actually don't think there's any plans at the moment for it to end. As I say, it's sort of been a 5-year process so far. And the plan, as far as I know, is for this to be an annual thing. We haven't been advised of any funding changes. So we've got sort of 2 areas that we use for funding for this. We've got a workforce development area, which includes all of that refresher stuff that's come off the back. And we've also got a specific funding stream for optimizing IT. And I think because it has been so beneficial, and obviously with all the contracts coming out sort of saying that we should be doing these annual reviews of clinical systems, I think it's sort of a long-term plan to keep this as a yearly thing.
Okay, cool. In terms of the NHS app, can NHIS provide training for patients? Because I know Connected Knots were doing some work with patients, weren't they, in little hubs across the county a while ago?
Yeah, so we do work quite closely with Digital Knots, and they, along with the digital social inclusion coordinators, have seen the session and fed into it as well. At the moment, our remit stops with practice staff, ICB staff, because that's what our funding is for. So we sort of provide that part, and Digital Knots are then employed to do the patient facing stuff. Yeah, but our sort of aim is to provide staff with that knowledge if they get the chance to be able to support, but at least to know where to point the patients in the direction of. So there are lots of things in the app, sort of help pages, and also an area where they can report faults and things. So it's beneficial for the staff to know where that is, rather than having to try and answer the questions themselves. They can point the patients in the direction of that area of the app, and they can report their own problems and have it dealt with by the NHS app team.
That's great. I think my worry would be that patients going into practices, then how do I work this when, it's not their responsibility?
Exactly,
Roll
yeah.
out from national, go and speak to someone else as a specialist. Lisa, you've got your hand up. Would you like to come in on that?
No. It was just what you just asked then, Stuart, regarding the NHS app. We did all receive an email last week from the digital team for NHS app asking if any surgeries want to book them to come in and do a hub in the surgery, so you can let the patients know, and they will show all the patients how to use the app. We're doing that, I think, this month and next month.
Okay, cool. It's good that there is an offer and it continues, really.
Yeah, I think that'll be the digital and social inclusion coordinators probably. I think the only downfall we've got at the minute is that not all areas have them. So I think they've been very, very useful in the areas that they're in. But I'm not sure that all areas do have them. So.
Okay, cool. Thank you, Rebecca. Thank you, Lisa, for your question. In the chat, Emma's put a question in there saying, is the new starter/refresher training available for both EMIS and System 1?
So the new starter is the refresher. We've got more the PCDC, so the safeguarding is available for EMIS. The refresher, we are still working on a few EMIS little bits, and the same with the NHS app training as well. So because we start the session with the clinical system, currently we've only got one for System 1. Our sort of boundaries with EMIS is that we don't have a system in the same way that we do with System 1. So we would need to work quite closely with practices to be able to provide that training accurately. So we're currently working on one for the NHS app, just trying to get sort of the proxy access and things to work so that we can give the correct advice. Just because there's not quite so much out there for EMIS as there is for System 1. But again, if you've got any specific areas in EMIS that you would like that kind of refresher training on, let us know and we'll do our best to work on more sessions. There's constantly going to be more sessions available. So again, any suggestions is appreciated and welcomed.
Great stuff. Thank you, Rebecca. Another question from Christine Clark at Boulderton. Do you provide training for admin staff for care navigation, signposting patients?
Yeah, so again, probably the new starter training, the only sort of not maybe a barrier is processes. So we do provide training for them, but it would be very sort of functionality driven. So within the clinical system, how things work, obviously each practice does have their own processes. So if you've got a care navigator, they may work differently to a care navigator in another practice. So we would absolutely provide training for them. But if you've got specific processes in practice, it would be a case of sort of using the two together. So our functionality training with your processes together to get them started. We do have sort of specific like templates and things that we will go through. So if we know they're a care navigator, we might go through certain things like referrals to pharmacy, that kind of thing. So we do have that as a slight difference between job roles, but we would have to bear in mind that everybody's processes are different.
Okay, excellent. Thank you very much. Okay. Christine's just come back saying, yes, that would be great, providing templates training. Thank you.
What I'll do as well is I'll obviously I've got the links to the refresher training on there, but when I send it through to you, Stuart, I'll send through our admin mailbox as well, because that is changing now. Of NHIS are moving across to nhs.net, so I'll send that new mailbox through to you, and any sort of ad hoc queries, if you send them through to that mailbox, they'll pass them on to the trainers and we can get something booked in.
Great stuff. Thank you very much. Okay, any final questions for Rebecca at all? Oh, excellent. Well, thank you very much for coming along today. Nice to see you and meet you. We look forward to having the slides, and then we can also put that in our newsletter as well, out to practices, along with this recording.
Brilliant. So, thank you.
Thanks for your update. Thank you, Rebecca.
Thank you. Bye.
Bye-bye.